time when he was CEO for Komfo Anokye, we had about 8 dialysis machines. So how come we have only 2? And for how long have we been using these 2?
Yeah, so indeed, when it was set up, we started off with about 8 machines, and I think I've been following the number of dialysis machines in the country for some time. And, wear and tear. And I think sometimes the issue of culture of maintenance to ensure that as the machines are wearing down, there should be a plan to keep increasing or restoring them. But I think that is not the situation on the ground. And unfortunately, currently, like you rightly said, we have 2 functional machines. I am happy to say that there's ongoing work in terms of some renovation. I mean, currently by the previous administration, which is being carried on aggressively at the Komfo Anokye Teaching Hospital to open up the place and hopefully get some more machines on board. But I think generally, we are hoping that it gets done quickly because as you and I are speaking, somebody is getting the disease now. Somebody would need the machine, somebody would need the services, and it is not available. So all we'll do is that we'll continue to pray for the powers that be to be able to ensure we get what we really need to be able to do that which we are trained to do.
So those other machines that you had before, is that to suggest that they have broken down beyond repairs? And like I asked earlier, for how long have we been using these 2 machines?
So so what happens is that, it goes gradually. All right. So it was 8 at a point, okay, 1 or 2 will break down and the servicing. And then we got some company, Nipro, some time ago, somewhere around 2015, 2016, bringing us some 5 machines. So yeah, we bounced back to our 8 again around that time. And then over the period, in fact, the last communication, virtually all the Nipro machines are not working now. And sometimes it is not necessarily because they are not working. Sometimes it's because they're consumables and the partnership sometimes with the providers in terms of payment, so like the Kolebu situation, it's not like they cannot dial. The machines are there. And that is why I need people to understand that it goes beyond just machines. So when people hear this discussion, I'm sure the next we are going to hear is that people donating machines. Well, people should understand that it's not just donating machines. All of these things comes with its attendant, resources, attendant consumables that has to be used, attendant health workforce. And that's actually another thing I really want to hit on as we continue in this conversation. So that is holistic. But talking about the machines generally, that too, we probably have been going for probably about a year or so.
So let's